In this course, you'll explore environmental sustainability and stewardship broadly to understand the scope of healthcare's impact on the environment and how you can be a part of the solution. Then you'll dive deeper into two fundamental areas for improvement: healthcare waste and climate change. After that, you will take the final quiz to earn your continuing education credit. As you proceed through this course, if you see this button, be sure to click it to get bonus information. You may also return to this menu at any time by clicking the menu button in the upper right corner. Click the forward arrow to continue. Let's start with your learning objectives. By the end of this course, you'll be able to understand and explain the definition of environmental sustainability and stewardship as it relates to hospitals, as well as identify environmental sustainability and stewardship challenges facing ORs and hospitals. And finally, you'll be able to start implementing the responsible use of resources, as well as start environmental sustainability and stewardship initiatives at your hospital. Click the forward arrow to continue. Hospitals are open all day, every day, all year round. This means that hospitals, and ORs in particular, come with a significant environmental footprint because of the amount of resources required to care for patients. In fact, U.S. hospitals generate more than 4.67 million tons of waste each year. That's more than the weight of 37,000 blue whales. The United States healthcare sector alone is also responsible for 10% of U.S. greenhouse gas emissions. So you may find yourself wondering, what does environmental sustainability and stewardship really mean? Why should I care? I'm just one person. Is this really part of my job? And if so, how can I make a difference? The rest of this chapter is designed to help answer these questions and more. Click the forward. First, let's define environmental sustainability and stewardship. Environmental sustainability is the state in which our demands on the environment can be met without reducing the environment's capacity to allow us to live well, now and in the future. To achieve environmental sustainability, this may mean all of us, including hospitals, need to increase our environmental stewardship and shift away from an ecological deficit, where our demands on the environment exceed the environment's biocapacity, or its ability to produce ecological assets, to an ecological reserve where biocapacity exceeds our demands. Using a science-backed approach can help hospitals to determine and reduce their carbon footprint. Click the bonus information button to learn about trends in hospital mindsets when it comes to environmental sustainability. A recent survey among U.S. hospital executives and operating room clinicians showed that they agree that environmental sustainability and stewardship can improve cost savings and protect the environment while improving patient care. What's your opinion? Do you think environmental sustainability and stewardship can help with all of the items shown on this chart? Environmental sustainability and stewardship has long been relevant to nursing, because it's well known that a patient's environment affects their health. In fact, Florence Nightingale first described this in her Notes on Nursing in 1860. By altering specific environmental factors, you can affect change in the patient's health. Click the leads to explore the factors described in Nightingale's work. It should be no surprise that modern nursing standards continue to focus on safety and quality of the healthcare environment. For example, the American Nurses Association nursing standards state that the registered nurse should practice in an environmentally safe and healthy manner. Likewise, according to AORN, registered nurses should serve as a steward of the environment and actively promote and participate in sustainability practices that preserve natural resources, reduce waste, and minimize exposure to hazardous materials. It's time for a challenge. Both clinicians below want to improve environmental sustainability and stewardship at their hospitals. Who do you think is more likely to be successful in their initiatives? Listen to each clinician, then select one to indicate your answer.
I have a project list of big changes I want our department to make. Now it's just a matter of finding the time and enforcing it.
After I formed a group who wanted to help, known as our Green Team, we decided to start small and work up to larger initiatives.
A green team is any committee or group dedicated to addressing environmental sustainability and stewardship. Which departments do you think are typically represented in hospital green teams? Select all that apply, then click Submit. There are many resources and organizations ready to help green teams improve environmental sustainability and stewardship. Learning all you can is important because once you know more, you can do more. And when you can do more, you inspire others to do the same. Your impact grows, and engaging others is vital to the success of any initiative. Let's try this with a little game. In this game, you'll learn more about the environmental impact of hospitals and ORs through a series of questions. Answer correctly to gain influencer points and grow your green team. What do you think is the median amount of waste an OR in the United States generates per year? In 2012, inpatient healthcare buildings in the U.S. made up a mere 7% of all large buildings, but they were among the biggest users of water. So what percentage of total water consumption did they account for? About how much do all U.S. hospitals spend on electricity costs each year? What percentage of hospital waste do the Centers for Disease Control and Prevention, or CDC, suggest truly needs to be disposed of as infectious waste? If the U.S. healthcare sector were a country, where do you think it would rank in the world for greenhouse gas emissions? Good start, but you weren't able to convince everyone to join your team. Would you like to play again or continue? Nurses are an influential force within any healthcare system. No matter what cause or initiative you and your teams decide to address first, it's important to understand key statistics and the goals you're working toward. And it's also important to be inquisitive. Find out how your hospital operates and ways you can help achieve environmental sustainability and stewardship practices within your organization. It's time to explore one of the most visible environmental issues associated with hospitals: waste. In this chapter, you'll learn about various waste streams and the potential costs associated with them. Then you'll explore what you can do to minimize waste and get some real-world examples from other hospitals and green teams. Let's go! From blue wrap embedding to patient forms to cups and food, waste is one of the most highly visible environmental issues at any hospital, and minimizing waste is often the starting point for environmental sustainability and stewardship efforts. Not all waste can be treated or disposed of in the same way. Some of it is strictly regulated. This creates two primary waste streams: non-regulated waste, which is simply sent to the landfill or recycling center, and regulated waste, which must comply with storage, handling, and treatment regulations prior to being sent to any landfill or being recycled. When it comes to regulated waste, it's important to understand that regulations can vary by location and agency. Regulated waste also generally costs more to treat than non-regulated waste because the processes are designed to minimize the risk of infectious or harmful materials affecting the environment or nearby populations. Can you identify which items belong in each waste stream? Drag and drop the type of waste into its waste stream, then click Submit. Let's review some key statistics. You already learned a bit about just how much waste hospitals generate. Recall that U.S. hospitals generate more than 4.67 million tons of waste each year, more than the weight of 37,000 blue whales. And the median amount of waste each OR generates is 90.4 tons, which is approximately the weight of 32 blue whale calves. When it comes to disposing of all that waste, there's another problem. Only 2 to 3% of it is actually infectious, yet many hospitals dispose of up to 50 to 70% of their waste in the infectious waste stream. This is costly because infectious waste can cost up to 10 times as much as non-infectious waste due to the treatment process. Besides the sheer volume of waste being generated, there are other concerns to be aware of. Food waste, regulated medical waste, and non-regulated waste are 3 areas where green teams and nurses, especially perioperative RNs, can have a lot of impact. Click to explore more about these types of waste. It's also important to understand the costs of the various types of waste. In the U.S., regulated medical waste and hazardous waste generally do not make up a large percentage of hospitals' total waste. However, they are expensive waste streams. Click on the charts below to zoom in. At home, you probably use 3 R's to minimize waste: reduce, reuse, recycle. But at a hospital, especially in surgical departments, extensive resources are used to maintain sterility and aseptic technique. That's where the 4 R's plus donation come in. In this activity, you'll explore just some of the ways nurses and green teams can implement the 4 R's. For each prompt, select the action items that will help minimize waste. As you go, be sure to read all feedback and hints. A recent audit revealed that half of red bags in your OR were being filled with non-infectious waste. Which action items will help ensure that only infectious waste is added to red bags? Select all that apply. Which of the following action items could help reduce the impact of waste generated by devices and device packaging? Select all that apply. Your green team wants to minimize the amount of food waste generated at your hospital. Below are the action items the green team has agreed upon. Which will you start with? Rank each item using the drop-downs. Explore real-world examples of successful waste reduction initiatives below. Nurses Amanda Gorsuch, Rebecca Westrate, and Mary Schultz at Advocate Good Shepherd Hospital in Illinois successfully eliminated unnecessary waste and expense by changing how patient rooms were prepared. They had noticed that many unopened and unused supplies were found in rooms after patient discharges and had to be thrown away. This resulted in excess waste and costs. So they devised a simple solution with the help of multiple departments, modifying how patient rooms are prepared. Patient toiletries and other supplies, such as sequential compression devices, would not be added to the room until the patient arrived and the exact supply needs were determined. Nurses Allison Rhodesmith and Shayna Sullivan at Ohio State University Wexner Medical Center diverted approximately 3,460 pounds of plastic bags from the landfill and saved their unit over $1,600 in 2017 by replacing plastic bags with reusable bins. They noticed that their outpatient surgery center gave out, and subsequently threw out, over 13,000 plastic bags used to store patient belongings annually. Staff members had the desire to recycle these bags, which were sometimes laboriously collected by volunteers and driven to recycling bins. So they came up with an alternative: reusable bins. They first elicited feedback and gained approval from management, staff, and epidemiology before purchasing and transitioning to non-porous bins that fit in patient lockers. They overcame objections about cross-contamination by confirming that the bins could be cleaned using the same Sana wipes used on other patient supplies. These nurses' sustainability efforts allowed their unit to save 13,350 plastic bags from landfills and saved their unit over $1,600 in 2017, while continuing to provide their patients with a safe and clean place to store their belongings. Registered nurse Patricia Stockwell at Dartmouth-Hitchcock in New Hampshire showed that 75% of dining and food waste in the OR lounge could be diverted from landfills by hosting composting and recycling education events. Click the bonus information button to learn more about composting, or click the forward button to learn more about Pat's efforts. Although the dining room already had composting mechanisms in place for food scraps, there was room for improvement. She noticed that 1,000 compostable cups per month were in the OR lounge that were not being composted. So she increased awareness of the issue and what could be done via signage and educational tables and events. During these events, the amount of receptacles was reduced so that staff would have to throw their waste into the appropriate bins. In addition, Pat was able to create incentives with prizes to engage as many hospital employees as possible. In an 8-hour period, they found that if the right decisions were made, they could divert 75% of waste from the landfill. Pat's dedication to providing environmental sustainability education and finding creative ways to engage employees, like with prizes, helped increase recycling and composting behaviors within the cafeteria and in the OR lounge. Great job so far! Review these key points about healthcare waste before continuing. You're ready to learn about another area of environmental concern, climate change. You'll get an overview of how climate change can affect public health and learn that one way to affect the impact of climate change is to focus on things that can help minimize greenhouse gas emissions. You'll also explore some real-world examples from other hospitals and green teams. Let's dive in. Climate change is an issue that not only affects the environment, but also communities that you treat. Environmental changes are occurring at a rate unseen over the last 650,000 years, primarily as a result of human activities, such as burning fossil fuels and other activities that produce greenhouse gas emissions. The more greenhouse gases, or GHGs, there are in the atmosphere, the more energy is prevented from escaping. Trapped energy increases the global mean temperature. This enhanced greenhouse effect leads to global warming and unprecedented rates of climate change. The amount of natural resources we use and how much greenhouse gas we produce combines to determine our effect on climate change. This effect is often known as carbon or an ecological footprint. All of our choices impact the size of our footprint, including how we travel, what we buy, how we use, dispose of products, as well as the behaviors of our suppliers and service providers. Take a moment to explore the diagram below, which illustrates climate change's effect on environmental exposures that in turn affect human health. What do you think are some of the subsequent health outcomes that can result from these changes in exposure? Select all that apply. All of the answer choices are correct. For example, effects of climate change include rising temperatures and more extreme weather, which leads to not only extreme heat, which can cause heat-related illnesses, but also leads to changes in vector ecology, such as the prevalence of malaria or West Nile virus. As a nurse, of course it's important to understand the effects of climate change on human health, but it's also important to understand the role healthcare plays in creating climate change. That way, you can be an active part of the solution. Recall from earlier that U.S. healthcare is responsible for generating 10% of the United States greenhouse gas emissions. In fact, the U.S. healthcare industry alone produces more greenhouse gases than all industries and populations in the United Kingdom combined. So where exactly do greenhouse gases come from? Every hospital and healthcare system will have their own greenhouse gas drivers, but broadly speaking, greenhouse gas emissions come from a variety of sources. There are the obvious sources such as energy production and transportation, but did you know that emissions also come from agriculture and industry? Within healthcare, GHG emissions are generated within all of these categories. Explore them by clicking on the images below. Minimizing the impact of climate change or reducing greenhouse gas emissions may not seem as straightforward as reducing waste, but there are several steps green teams can take. Just keep in mind that the goal is to reduce healthcare's carbon footprint using science-backed methods, enlisting the help of others, and understanding your hospital's operations better. In this activity, you'll explore ways to increase environmental sustainability and stewardship while working to reduce healthcare's carbon footprint. As you go, be sure to read all feedback and hints. Your green team is doing a hospital-wide energy initiative to reduce resource consumption and reliance on fossil fuels. You notice that ORs regularly look like this when not in use. What will you do right now to save energy? Select the two options that are the simplest and require the least budget. You want to make food more sustainable at your hospital. Brainstorm 2 ways in which procuring more locally sourced organic plant-based food for the hospital could help minimize the hospital's carbon footprint. Type your ideas in the boxes, then click Submit. Your state has experienced drought for several years. What can your green team do to help conserve water and address the impact of this aspect of climate change? Select all that apply. Do you think the statement below is more likely to be true or false? Explore real-world examples of how hospitals have reduced their carbon footprint. Innova was able to reduce their carbon footprint by implementing several transportation programs, including a car-free challenge that resulted in 455 car-free trips taken by IFMC employees to and from work. In 2017, the American Lung Association's State of the Air report gave Innova's service area of Washington, D.C. a failing grade for smog. In an effort to improve the air in their communities, Enova's Office of Sustainability assumed oversight of transportation initiatives and hired a transportation lead to work with staff and develop programming. These efforts resulted in several alternative transportation programs, including offering employee-focused programs and initiatives like the Car-Free Challenge, as well as joining forces with other departments and the local Department of Transportation to create employee commuter fares. At Virginia Mason Medical Center, a variety of initiatives ensure that their ORs consume less energy and resources while still providing high-quality care. For example, various perioperative team members formed a green team to implement sustainability ideas. Virginia Mason also implemented the first OR plastics recycling program in the Pacific Northwest, increased the amount of devices they can have reprocessed, and continues to install energy-efficient LED lighting and occupancy sensors to reduce the amount of energy and resources used. When it comes to climate change, our choices affect the impact that we have, whether positive or negative. What we do, what we buy, how we use and dispose of things can all impact the amount of GHGs produced and climate change. The key is to find ways to sustain behavior change that will have minimal impact on the climate. Congratulations! You're ready to take the final quiz. This brief quiz will test your understanding of this e-module's key concepts. You will have one chance to answer each question. You must score at least 80% to pass. What is the definition of environmental sustainability? Which of the following are actions ANA and AORN nursing standards say nurses should take? Select all that apply. Approximately how much waste do U.S. hospitals generate each year? According to the CDC, how much of a hospital's waste actually needs to be disposed of as infectious waste? Compared to general or non-hazardous waste, infectious waste can cost up to how many times as much to dispose of? How is a regulated waste stream typically different from a non-regulated waste stream? Select all that apply. How are greenhouse gases, GHGs, and global mean temperature related? Of the following, which type of agriculture generates the least greenhouse gas? Which of the following can impact a hospital's carbon footprint? Select all that apply. Which of the following are simple steps you can take right now to reduce energy usage and minimize waste in the OR? Select all that apply. The results are in. You need to achieve a score of at least 80% to pass. Would you like to retake the quiz? If so, click the Retake Quiz button. What is the definition of environmental sustainability? Which of the following are actions ANA and AORN nursing standards say nurses should take? Select all that apply. Approximately how much waste do U.S. hospitals generate each year? According to the CDC, how much of a hospital's waste actually needs to be disposed of as infectious waste? Compared to general or non-hazardous waste, infectious waste can cost up to how many times as much to dispose? How is a regulated waste stream typically different from a non-regulated waste stream? Select all that apply. How are greenhouse gases, GHGs, and global mean temperature related? Of the following, which type of agriculture generates the least greenhouse gas? Which of the following can impact a hospital's carbon footprint? Select all that apply. Which of the following are simple steps you can take right now to reduce energy usage and minimize waste in the OR? Select all that apply. The results are in. Congratulations, you passed the quiz. Click the forward arrow before you go. Are you ready to take action? Yes, you are. It's time to explore more resources. Join or start a green team. Begin implementing the 4 R's and working to change behaviors to reduce your hospital's carbon footprint. Congratulations! You just completed the lesson on environmental sustainability and stewardship. You may now exit this e-module.